Hello, and welcome to another episode of Cutting Edge Health. And today, what we are talking about is how to be able to use TMS, which is short for Transcranial Magnetic Stimulation, for treating nerve pain. If we haven't met, I'm Dr. Orlando Landrum, a regenerative medicine and behavioral health physician that helps patients be able to figure out how to be able to punch pain in the face and get back to leading the life that you deserve. Today, we're going to talk about different types of pain. We're going to talk about nerve pain specifically and the different types of nerve pain and how you can use a machine that's built for the brain in order to be able to improve pain that is a multitude of different types that sometimes is very difficult to be able to treat. For those of you who are joining us live, by all means, jump in, ask questions, and we'll be happy to try to answer them. Give us commentary about things that you need or want us to kind of talk about. But we're going to start off with an article and give some insight about where all this kind of comes from. So there's an article that looked at how to be able to look at both pain as well as depression. And this article looked at what TMS does. So for those of you who haven't been able to kind of get an idea about what TMS is, it gives a quick explanation of this chair that you saw originally in the first slide. So you can see this chair off to the right-hand side, and that chair is where the patient sits. There's nothing that is put into the skin. There's no injections. There's no infusions. They just sit there. They have a small tapping that's there, and that tapping is what is actually ends up improving things. So a TMS session is somewhere between 15 and 30 minutes. And there's a number of different stimulations that occur during that time, but about anywhere from 1,500 to about 3,000 stimulations can occur. And it depends on the type of condition and the frequency that's being used. And as summarized, the brain is an information processing system that utilizes electrical currents. And in essence, every electrical current that's present generates a bit of a magnetic field. And that magnetic field can be perceived from inside to outside, but using an inverse principle, that magnetic field can be able to be utilized by TMS to influence areas of the brain to improve function, and function in particular, in this particular context that we're talking about, that deals with pain and pain relief. So just so you know, this isn't a new concept. This is something that's been out for a while, despite what many people might think. So we covered this in kind of a conglomeration talk that we had previously, but this is a talk where we want to kind of delve in even a little bit more. So one article did a narrative review of TMS and how it affects pain. And so what does that mean? It looked at a number of different articles. As a matter of fact, it looked at 1,030 articles that had to do with pain and TMS of some sort. And if you skip down to this line over here, you can kind of follow that cursor. What you can be able to see is that there were 106 publications that were actually analyzed. And of those, most of them had to do with some form of neuropathic pain. So neuropathic pain, again, being a nerve pain type phenomenon, right? We're going to talk about that a little bit in depth and detail. But at the end of the day, what we're talking about is nerve pain. And nerve pain can be of a lot of different sorts. People will say, well, exactly what does one feel with nerve pain? You can feel a lot of things. You can feel kind of like a migraine type sensation that can occur that's mediated. You can have pain that's present in the knee that can occur. You can have back pain that can occur that can give you all kinds of problems and issues. So there's a lot of different types of pain that can occur that are associated with nerve pain. And we're going to talk about that in depth and detail. But at the end of the day, what you're going to want to know is that there's a lot of ways that you would experience it. So nerve pain can be experienced as a stabbing, a shock-like sensation, pins and needles. It can be a numbing sensation. It can be throbbing. It can be shooting. It can be burning. All of those can be indicative of nerve pain, and it can be in a number of different areas. At the end of the day, when they looked at 103 of those publications, what they were able to find is that TMS was an alternative therapy that could be utilized for the following conditions that we're going to talk about in depth during this conversation. It can be used for oral facial pain, including trigeminal neuralgia. It can be used for PLP, which is phantom limb pain. It can be used for low back pain, myofascial pain syndrome, which is a muscular component. It can be used for pelvic pain, which we're going to talk a little bit about. It can be used for CRPS, which is complex regional pain syndrome. It can be used for postherpetic neuralgia, brachial plexus. And a lot of these are things that sound like fancy terminology, but as always, we're going to break it down, have you understand exactly what I'm talking about so that you can really be able to kind of get it. We're not going to have your brain hurting. We're going to make that better so it doesn't hurt, right? And at the end of the day, we're going to explain it to you so that you get it. So what I want you to understand is we're going to take this piecemeal and we're going to say, okay, how can we be able to get some understanding of this? So let's start off with one topic that looks at pain, particularly of a nerve pain that's broad in nature. So this study was published in Pain. It looked at a trial of 5 sessions done for a continuous trial of 4 weeks that were repetitive, right? And at the end of the day, let me just be clear. Traditional TMS utilization for depression is about 30 sessions or so. And most of the sessions that we've seen for pain haven't been as robust, and they could be in order to get a better outcome. But what we're looking at is kind of the initial literature that is just starting to kind of be developed and is only becoming more and more prevalent. So that paper looked at different types of pain. So there's central pain and there's peripheral nerve pain. So central pain being things like spinal cord injury or stroke, which you've talked about in one talk, or peripheral pain being things like postherpetic neuralgia, complex regional pain syndrome, phantom limb, diabetes. All those type of things have been indicative of different types of pain. So they looked at a way to be able to kind of assess this with the study that looked at initially an enrollment phase and a randomization, and then they did a trial that looked and followed patients during a continuous element with a follow-up period. And what they were able to see, just in quick summary of this particular type, was a pain that started somewhere around a 7, and you can see that the active is the continuous line, and that the sham or control or placebo is kind of the dotted line. And what you're able to see is a pain that went from a 7 down to somewhere around a 4 or 3. And I think most patients would say, you know what? I take going from a 7 to a 3. It will let me be able to be functional. But what we want to do is kind of delve in even a little bit more so we have more context and understanding. So let's talk about diabetes a little bit. By the way, if there are questions, ask them. I'll be happy to answer them during the live stream, and we'll kind of give you some more insight about what's going on. So this paper looked at the utilization and application of transcranial magnetic stim in diabetic neuropathy. So again, to reassess that fancy blah, 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 transcranial magnetic stim, or TMS, is being in that chair with no infusions, no injections, no medications, but just kind of a light tapping that's present for anywhere from about 15 minutes to 30 minutes, depending on the type of protocol that's in place, with multiple different treatments that can hopefully be able to improve this over time with no invasiveness and minimal side effects, right? So we talk about diabetes. Well, how do diabetic peripheral neuropathy patients show their signs and symptoms? Where they look a little bit like this. So they have a burning pain, a jabbing pain, traditionally in the foot and the ankle. It can be tingling, it can be throbbing, it can have numbness, and it can even result in things like ulcers and infections if it goes too far. So this paper looked at a split, and they knew that TMS has a number of different functions. And what they were able to see is that TMS can be used to be neuroprotective and regenerative in nature, which I'll kind of explain in just a second or so. It can be used to help for pain. It can be used for depressive symptoms. It can be used for autonomic neuropathy, and it can be used for pathology type research, right? Well, the neuroprotection and regeneration actually has some really interesting pieces, which we may cover in another talk if people are interested. But at the end of the day, what they've been able to see is maybe it helps prevent and decrease cognitive decline. So for patients that might have issues with Alzheimer's or dementia, being able to halt or stop some of those symptoms from progressing is one of the interesting pieces about TMS. But in this context, we're talking about pain. So there's a paper that looked at diabetes that stated what are the short-term effects, and this was in Pain Physician, of repetitive transcranial magnetic stimulation on diabetic peripheral neuropathic pain. So again, if you recall just a slide or so ago, we talked about that pain that's present in the foot and the ankle that can be shooting, it can be tingling, it can be burning, right? And instead of you doing injections or medications like gabapentin or Lyrica or other invasive type therapies, what they used was a non-invasive therapeutic trial of TMS. And so what did they find? What they found is just using a simple, very simple, not a prolonged protocol, was that DPN was reduced at 1 day and 1 week post-treatment. And this was only 5 sessions. To be frank with you, when normally you're having a treatment for major depression, it typically takes anywhere from about 14 to 15 sessions at least before you see a response. And in this context, they saw a response after 5 sessions of a stimulation to a certain part of the brain that gave some degree of improvement. And according to this paper, they believed that repeated, which is what the little r stands for, repetitive TMS is a useful therapeutic option for patients that have pain from diabetic peripheral neuropathy. Okay. So we're going to go through a number of different studies. The next one is going to be looking at phantom limb. And so we're going to explain to you what that means if you don't already know. But it's a paper that looked at the repetitive transcranial magnetic stim, so again, blah, 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 of TMS for phantom limb pain in landmine victims. And one of the reasons why they looked at this is because there's a huge context of a number of patients that have limbs lost because of landmines, and we'll talk about that in a little bit more than likely. But at the end of the day, we want to kind of explain what is phantom limb pain. So phantom limb pain is pain that occurs following the loss of a limb. And that can present as a stabbing sensation, a muscle cramp, as having some degree of shooting, shocking, burning, and feeling an unnatural position despite the limb not being present. And most of that has to do with having the nerves feel that limb potentially being there in space and thinking that it's still there, and it's giving sensations to the brain which are not pleasant. So this paper looked at using TMS, that non-invasive treatment, or transcranial magnetic stim, or if you're fancy, blah, 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 right, in order to be able to kind of figure out how to be able to improve. And so they looked at 54 patients with phantom limb pain, and they did a randomized, double-blind, placebo-controlled group, which is the fancy way of doing a procedure. And they did treatments that involved 20 trains of 6 seconds, and they did it for 20 minutes per day for 10 days. Again, not being an extensive time frame, but a moderate to minimal amount. And so kind of coming back to the number of people that have phantom limb because of injury, what they know is that worldwide landmine victims are pretty common, where you can see as many as 15,000 to 25,000 victims each year. And so those individuals can have this disabling pain syndrome that's phantom limb pain, where they feel, as stated before, perception of an amputated limb after a partial or complete deafferation, which is this pain syndrome that occurs because of an injury to the nerve. So what they found is when they did this treatment is that there was no adverse effects, that it was safe, and it provided efficacy in a clinically significant way, that there was pain reduction that was present for patients that had this phantom limb syndrome and were able to be treated by having this non-invasive therapy that provided relief. Okay, so we know all this now, right? So what else could this potentially be able to help for that you might not necessarily think about? Well, how about for pelvic pain? So we take a look. There's a paper that looks at brain stimulation may be able to ease chronic pain, pelvic pain. So I think most people would say, well, how is that even possible? Well, when we look at the pelvis, it has a number of nerves that innervate structures. And we can see these nerves and confluence of nerves that go into the area around the sacrum, the ilium, ischium. It supplies components of the rectum, the cecum, the bladder, the various different reproductive organs, and that is just ripe with a number of nerves. And those nerves can be influenced in a good way by using something like TMS. So this particular paper was small in nature, but it looked at 12 women who had endometriosis. And they did 5 sessions, which is, again, a short number, 1 per day. And what they were able to see is that 50% of patients reported having some degree of headaches and 25% had some degree of weakness. But out of the 12 women, 9 ended up having improvements in pain, which is a pretty good number. And so to be able to look at how this might be able to improve a number of different types of problems and issues that can result, really interesting. So now we're going to take a look at brachial plexus and explain what that means and how a plexopathy or pain that's present within the area of the shoulder that comes from the nerves, how that can be able to provide some benefit. So this was a single case study that looked at a woman who had this increased pain syndrome from having an issue with the brachial plexus, and it was able to be treated with high frequency TMS with improvement. So what is a brachial plexus injury? Well, I'm glad you asked. So the brachial plexus sits in and around the neck and the shoulders. It comes from the lower nerve roots of C5, 6, 7, 8, and T1, and they come together to form this network. And if you can see the colors, this area forms the sensation that's present within the shoulder, this area of the red for the elbow, the green for the wrist, and the blue for the actual fingers and digits. And when those areas are injured, it can result in pain, and TMS can be able to help improve those pain type symptoms. So you can see we have a broad swath of things from diabetic peripheral neuropathy to brachial plexus to pelvis. And one of the things that we're going to talk about is facial pain. So in facial pain and oral facial pain, traditionally, you can have something that's called trigeminal neuralgia, where the nerve that sits in and around this area in this picture is actually the causative agent for having pain that's present within the jaw, the nose, above the eye. And this particular study looked at it, evaluated, and what they're able to find is that it was able to provide some benefit to patients that have facial pain as well. So in summary, to kind of like pop up this one screen that we looked at earlier, it can, referring to TMS, it can help for stroke pain, it can help for spinal cord pain, it can help for peripheral pain, from postherpetic neuralgia to brachial plexus injury to complex regional pain syndrome to phantom limb. And when you think about all of those different conditions and you say, you know what, normally you'd have to use drugs, you have to use injections, you have to use implantable devices, or you might have to use surgery, and you can be able to avoid or skew all of those things by doing this in a non-invasive way with sessions that provide value, and you don't have to have potential side effects outside of some tenderness that's present at the scalp. Why would you not consider doing something like this? So what we want to do is make sure that we present options to our patients that otherwise may not be things that are brokered to them by their traditional pain physicians, by some of their physiatrists, or even by their traditional primary care doctors. Hopefully, as a channel, we're providing value so that you can find ways to be able to improve your pain, be able to punch pain in the face, and get back to leading the life that you deserve. If you have questions or you want to know more about how to be able to treat pain using TMS, reach out to us. We have a number of different ways to be able to do that. Everything from being able to subscribe to our YouTube channel, which is Cutting Edge Health and Cutting Edge Pain Relief, to being able to join kind of our newsletter, which gives more information on a daily basis. So if you go to the following cuttingedgepain.com/newsletter, you can jump on and be able to get updates of when we're going to have different talks like this one that hopefully will be able to help you figure out how to be able to take your life back and do the things that you want to do. Thank you again so much for attending. And if you have questions, please leave them in the comments and we'll see what we can do about trying to be able to answer those so you can be able to live life fully. Have a great day.